video about the thyroid. I have already told you about that in the next in succession to the next topics of the thyroid gland. Moving on to the another very important topic which is very difficult to remember and understand is about the thyroid surgeries. So, thyroid surgeries. Thyroid surgeries can be broadly divided under very important, that is the six types of thyroid surgeries are there, and these six types of thyroid surgeries are basically we can understand by looking at the review as to what are the different types of thyroid surgeries. So in the different types of, as to what is the need and when, in what all conditions we are going to have with the thyroid surgeries, in what all conditions, in this video I'll be focusing upon as to what are those situations or conditions where thyroid surgery is a must. So students, in the previous videos I have already talked about as to in certain cases when the levels of thyroxine, that is the T3 and T4, if they are very much elevated, the patient may exhibit hyperthyroidism. So surgeries in the thyroid gland are the first indication for them is in patients of hyperthyroidism. So the patients who are exhibiting hyperthyroidism, who are manifesting the clinical features of hyperthyroidism, they need to undergo, in if it is uncontrolled, if the hyperthyroidism condition is relapsing again and again, even after the administration of the anti-thyroid drugs, thyroid surgery becomes must, or it's important, it's very urgent, necessary to carry out. So if in a hyperthyroid patient, even after the administration of anti-thyroid drugs, the relapse of hyperthyroidism is occurring. So in such cases, thyroid surgery becomes the very important line of treatment. So, and the thyroid surgery, they are also indicated in young males. So in young males, if they are going to have a very large goiter and if they exhibit hyperthyroidism, thyroid surgery again becomes very important to be carried out. Next, the very important thing, another very important condition where thyroid surgeries needs to be, where it is indicated, it is in cases of a pregnant woman. So in pregnant women, in order to control the levels of thyroxine, if the anti-thyroid drugs, they are unable to elicit their action and the relapse of hyperthyroidism is occurring again and again, so thyroid surgeries need to be carried out. When talking of the complications of the thyroid surgeries, in cases of thyroid surgeries, there are basically two very important uh, complications what are seen. The first complication what it is seen is that recurrent laryngeal nerve palsy. So in the anatomy series, I have already discussed about as to what are how the recurrent laryngeal nerve is associated with the thyroid gland and how its course is closely related to the thyroid gland. So the very important complication what can be looked upon in cases of thyroid gland surgeries, it is the palsy of the recurrent laryngeal nerve. So the recurrent laryngeal nerve is most likely to get damaged during a thyroid surgery if it is not taken care of. The next very important complication is the patient who have undergone thyroid surgery may exhibit hypoparathyroidism. So the patients may also manifest with hypoparathyroidism, and if in certain cases even after the surgeries also the relapses of hyperthyroidism can be seen. Even after the surgeries, there are chances that even after the surgery also the hyperthyroidism can be seen. It can also recur. The recurrence of hyperthyroidism can occur. So when looking at the surgeries in the thyroid gland, so the thyroid gland surgeries, they have been studied under the very important, the six important headings, which is basically depending upon the anatomy of the thyroid gland. As students, you already know that the thyroid gland, it is consisting of a right lobe, a left lobe, and an isthmus in between. So the right lobe and the left lobe are connected by an isthmus in between. So the first surgery what is carried out? The first surgery what is being carried out in the thyroid gland is the lobectomy. So what is lobectomy? The first surgery is lobectomy. So this lobectomy suggests that only a single lobe, either the right lobe or the left lobe, is cut and removed. So in the thyroid gland surgery, when a particular lobe, a particular right or the left lobe is excised out, it is cut, leaving the rest of the gland, either the right or the left is cut down, leaving the rest of the gland intact. It is called as lobectomy. Moving on to the next important type of surgery, that is the hemithyroidectomy. So the hemithyroidectomy is actually when the thyroid gland is cut from the one of the lobe and it is extending up to the isthmus, that is the up from one lobe to the other lobe, this much is cut, leaving behind the rest lobe. So in hemithyroidectomy, a lobe and the isthmus, either the right lobe and the isthmus or the left lobe or the isthmus, it is cut and the remaining thing is left out. So this is hemithyroidectomy, where half of the thyroid gland is cut. Moving on to the total thyroidectomy. The next type of surgery what is carried out in cases of thyroid, it is the total thyroidectomy, where the entire gland is removed. So the right lobe, the left lobe and the isthmus all are just excised and removed during the surgery. So this is about the total thyroidectomy. Now moving on to the next very important type of thyroid surgery, it is called as the subtotal thyroidectomy. So in cases of subtotal thyroidectomy, what we find is that 4 gram, students look here, 4 grams, this means if I take it as this much portion of the thyroid gland is 4 grams, and from the left lobe also, if I excise this 4 gram, this much 4 gram. So no, if it is subtotal thyroidectomy, means the 4 gram bilateral is retained. Students, 4 gram bilateral of the thyroid gland is retained, and the rest everything, that is this much is all removed. So is it clear, students? 4 grams bilaterally it is retained and the rest remaining of the gland is going to be removed. So in cases of subtotal thyroidectomy, what the striking or the chief distinguishing feature is that 4 gram of the gland bilaterally it is retained and the rest of the entire gland is removed. Clear? Moving on to the next important thyroid surgery, that is the near total thyroidectomy. So in cases of near total thyroidectomy, what it is there is just 2 grams. So just take it for granted to this much. If it is 2 grams here, and from here also we are going to leave at least 2 grams. So if 2 grams bilateral, clear, students? If 2 grams bilateral, they are retained. 2 grams on either side, they are going to be retained, and rest entire of the gland is removed. It is known as near total thyroidectomy. All right. So the subtotal thyroidectomy and the near total thyroidectomy both are very difficult to remember. So students, make this point very clear that if 4 gram bilaterally we are going to retain, and rest all the gland is removed during surgery, it is known as the subtotal thyroidectomy. And if during the surgery that on both the sides, that is in the right and the left lobes, we are going to retain 2 grams on both the sides and rest of the gland is removed, it is known as the near total thyroidectomy. So in near total thyroidectomy, 2 grams bilateral are retained, rest gland is removed, and subtotal 4 grams bilateral are retained and rest of the gland is removed. Moving on to the very important and a very most frequently asked questions in the various multiple choice questions or the MCQs or in the professional exams, it is about the Hartley Dunhill surgery. So this has got a particular name, and students, you to remember this. That is, what is the Hartley Dunhill surgery? So in the Hartley Dunhill surgery, what it is there is that it is the 4-gram unilateral. We are going to retain the gland and rest of the gland is removed. Either from the right or the left half, 4 gram of the gland is going to be retained and the rest of the gland is removed. Then this condition, this type of a surgery, what is carried out, it is called as the Hartley Dunhill surgery. So in Hartley Dunhill surgery, there is 4 grams unilaterally. We are going to retain the part of the gland and rest all of the gland is removed. Then that is called as the Hartley Dunhill surgery. So students out there, if you do like my video, don't forget to subscribe my channel and do press the bell icon so that you can be further updated about my coming videos. Thank you for watching.